You know, one of the most compelling issues in veterinary dermatology over the last several years has been the rise in the methicillin-resistant staph infections. And even though technically it's not MRSA, it's not Staph aureus, most of our patients are having infections with Staph sut intermedius. Horses and cats, we will see some Staph aureus, but for the most part it's rare in dogs. But what's not rare anymore is to see the resistant strains. For the first 20 years of my career, I might see 1 or 2 resistant staph infections a year. We didn't even talk about it or bring it up. These days, we're seeing it on a daily basis. Some of my colleagues in other places around the country are seeing patients up, the numbers of patients that they see are approaching 50% of the time when they have a staph infection, it's resistant. And the compelling reasons as far as why has this occurred over the last few years, the microbiologists are basically pointing to 2 factors. One is the visit to a veterinary hospital or clinic. And there's a significant increase in resistance when patients have been hospitalized. Surgical procedures also have played a role. The second compelling reason that we're seeing such a significant rise in these infections is because of the use of antibiotics. Primarily fluoroquinolones, although cephalosporins have also been linked strongly to the development of these resistant strains. Most studies show that patients who are being documented with a methicillin-resistant staph infection have received antibiotics within the previous 30 days of time. And so the old adage of just treating rashes with antibiotics really needs to stop. We need to be more certain of our diagnosis when we see patients with lesions, and the use of the antibiotics needs to be appropriate both by minimizing or preventing the use or avoiding the use of fluoroquinolones, if at all possible, and using the appropriate doses and length of time with our systemics. Moving forward, I'm afraid the genie's out of the bottle, as they say, and we're not going to be able to prevent more future staph infections or resistant staph infections. So I think it's important that we think about what can we do to minimize the transmission and minimize our role in the development of these infections. And the 4 points that really I think about every day with my patients is, 1, when we use antibiotics, that we use the appropriate ones and appropriate doses and appropriate length of time. But the second point that we are doing now in our practices is even more zealous use of topicals and the antimicrobial, the antibacterial shampoos and sprays and rinses. There's a lot of options out there for us, and we use those products heavily. The third primary point to make is hand hygiene. That consistently is shown to be a major factor in transmission of these staph infections. So washing our hands in between every patient, the use of those alcohol-based hand sanitizers have been shown to be very helpful in the prevention of transmission of the infections. The fact is we're part of the problem there. And then finally, and the most important point is, when we have patients with staph infections of their skin, dogs just don't get staph infections without a reason. There's always that underlying cause, and it's important that we find that underlying cause and deal with it. There's been a definite paradigm shift in our thinking. And for years, it was do whatever was possible to avoid the use of corticosteroids, even if it meant using lots of antibiotics. These days, that role has changed, and we use more steroids than the antibiotics. It's not that the steroids became better, it's that the use of the antibiotics became worse.